Just wait for a few people to join in. Hi, Mulya. Hi, Nandu. Dr. Pragnya is now going to be joining us. Hi, Dr. Pragnya. How are you doing?
Thank you. I'm good, thank you.
I'm doing well. So, before we get started, would you like to introduce yourself?
Yeah, sure. Well, I am Dr. Spurthi Mallampati. I'm a consultant breast specialist and oncoplastic surgeon. I'm currently working at American Oncology Institute in Hyderabad.
Oh, that's great. So, to everyone here, today we're going to be talking about breast cancer. And October is the Breast Cancer Awareness Month. And the reason every October is celebrated annually is to create awareness and to learn about it. And like Pragnya's tagline is, the best protection is early cure, right? So we're going to be asking Dr. Pragnya a few questions about breast cancer. And let's hear what she has to say about it. So, Dr. Pragnya, I want to know, so when we say breast cancer, who is at risk for breast cancer?
Well, there's a myth that it's only women who are actually at a risk of breast cancer, but that's not true. Men they are at a risk as well. Well, even though the total percentage of men who might be affected with it are less than 10%, amongst the women, well, let's just say there are multiple factors, some which can be changed, some which cannot be changed, which affect a woman, which causes breast cancer. For example, women with obviously a family history, like a strong family history of breast and cancer, are at a higher relative to the risk population. And besides that, you can see that in India, the number is increasing because of the westernization of diet, predominantly diet, lifestyle factors as well.
Right.
And it's more of red meats, etc. And our lifestyles as such, especially for women who've become very ambitious, want to have careers, they have changed. And I see a lot of women having kids in their 30s compared to 20s, and maybe having one or two children, as compared to the past where they used to have 7 or 8 children. Although the government might be happy with this, so that is a risk factor relatively for. But and then again, breastfeeding and a few other aspects which are very, very different from rural areas to the urban areas, but those are the risk factors.
So you're saying it affects everybody in all age groups equally, or is it different from every age group?
So dominantly, it's in the postmenopausal age group, and in India, the menopausal age group is around 50 and above that. But we have seen that in studies, most of the patients who are being detected with breast cancer are between 40 and 49. So that's obviously younger than the menopausal age group. And in the last 25 years, we've seen a spike of patients between 25 and 40, which is extremely alarming.
So there's an increase in the younger age group as well. So we need to be careful as well. All right. So also you're saying there's an equal incidence in both urban and rural women?
No, in urban India, it's much, much more. And that's 1 in 22 compared to rural India, which is 1 in 64. So there's
So there's a vast difference. All right. So I want to know, is there any way we can prevent this?
Well, there's no, obviously there's no particular strategy to prevent breast cancer. But yes, having a healthy diet, increasing green leafy vegetables, and increasing, anything with phytochemicals and antioxidants, such as fruits, vegetables, etc., compared to meat, alcohol, smoking. Well, lifestyle and this. And the other important thing is, if you have a strong family history of breast cancer, it's very, very important that you start surveilling very, younger age. You get counted. They tell you how to go about it.
Okay. So is there a vaccine? So you know that when we say cervical cancer, we have a vaccine available, right, for prevention. So is there any such vaccine that we have for breast cancer?
At the moment, no. At the
No.
moment, but there are a lot of studies that are going on, some based on like cell-based vaccines, and the
Okay.
other something called antigen-based vaccines.
Okay.
Uh,
Okay.
one of them have their own challenges, and a lot of studies are going on about them in the West, in multiple different parts of the country. But at this moment, unfortunately, it's not available. Well, hopefully, there does come in the future.
Right. So, so I also wanted to let you guys know, everybody watching this, if you have any questions, please post them in the comments. So Dr. Pragna will answer them for you. So when we say the best protection is early detection, what do you mean by early detection? What kind of screening do you mean?
Okay, that's a good question, and I really want to educate people on this. Even though they're like, even if through this interview, even one person gets educated about it, that'll be great. So, screening techniques as such, there are three main ones. One is a breast self-examination. The other is
Okay.
clinical examination, which are two different things. Clinical
Okay.
examination is something that we, as healthcare professionals, do for the patients when they come to the hospital, and the
Right.
imaging is a mammogram. In the first
Huh.
examination, which is done by which has to be done by every woman every like after month, and if they find any abnormality, anything different from
Mm-hmm.
the operative, they should come up to the doctor so they can be evaluated. And clinical breast examination is something that we do for the patients when they come.
Right.
So
Right.
40 onwards, it's recommended that every woman undergoes a mammogram and a clinical breast examination every year. Now,
Okay.
unfortunately, in the West and in most of the other countries like UK and etc., they
Right.
have
Right.
standards. Get mammograms done every 2 years, and they send letters home. They send reminders home,
Right.
so
Right.
the woman does. Unfortunately, we can't do that in this country. It's huge.
Yeah.
This country is huge.
So when
Gone.
this came up, I was telling my mom about it, and she wasn't aware too. And I don't think she gets a mammogram once every year. I'm pretty sure she got it done after 5 years after I forced her to. So I am sure even like amongst doctors, there's no awareness regarding this.
Yeah, well, doctors they do know, but then the thing is, it's very easy for Indian women to
Mm-hmm.
not put too much light, especially
Right.
Indian women. I've seen,
Right.
I wrong, but I've seen it in my practice that
Okay.
everyone gets so involved in their day-to-day activities. They're just like, okay, fine, I'll just get it done some other day. But having said that, mothers really pain. You have to push and push and push them until they actually get it done.
Right. Right. So I think till it's real, people don't take it seriously, but you might as well get screened earlier, right?
Yeah, so
So
that's what early detection leads to early prevention means, right? So if you have even a very, very small lesion, either clinically palpable or if it's, well, on you find a mammogram, that's
right.
always better
Right.
in a very advanced stage. So early detection does have a better prognosis at the end of the day.
Okay.
So hence you can prevent it in a certain
Okay.
way.
So when you were saying self-examination, I actually got this really nice voucher, like brochure that you gave out. It actually showed everybody how to self-examine yourself, right? So will this information be available on the internet if somebody wants to just examine themselves?
Yes. So I am, well, absolutely for no other reason other than spreading awareness. I am putting a couple of videos, and it
Okay.
just is yet to be launched. So every bit of information that you need to have will be on
Right.
those, well, my Instagram and other social media apps. But having said that, also there are a couple of videos online, and anyone
Okay.
who wants can just type in breast self-examination, and you will be able to find them.
Okay. So when we're talking about mammogram, I want to know what kind of a procedure is it? Is it going to be painful? Is there going to be radiation? Do people need to be worried?
So mammogram, basically what happens is that they take the breast of a woman, they put it in two plates, right? So from top to bottom and from side. So
Okay.
then get like some films on which we see if there's any lump or if any abnormality. So in mammogram, and yes, obviously it's placing the breast between two plates and like squeezing it. So it will
Right.
be painful. But at the end of the day, what you should realize, and what every woman should realize, is the pain that they might go through for those 2 minutes is worth a lot lesser than what benefits they might earn from early detection of if there is any lesion in the breast. And
Okay.
very minimal. So that's another reason people generally don't get mammograms, because they're really scared that there's too
Right,
much
right,
want to get exposed to radiation. But the
right.
amount is less, so it's not going to you too much.
Okay. So when we are saying we're looking for warning signs during this self-examination, such as lumps, right? Would any kind of lumps mean cancer or
No, 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 no. See, that's another myth. Every
okay,
lump is not a cancer.
okay,
Around 9 out of 10 lumps are definitely benign.
okay,
Plus, when a person suddenly feels a lump, I've seen this in my practice again, suddenly come crying in front of me saying, I have a breast. It's very obvious that they would get really worried about having a breast lump, but then most of them turn out to be benign, right? So
okay,
the other warning signs besides a breast lump would be things like skin thickening, any skin changes,
okay,
uh, any warmth. Warmth is red. It's a confusing sign, but it still
right,
could. And
right,
then
okay,
where you might have some discharge, which might be bloody, it might be clear,
okay,
might be greenish sometimes, and that
okay,
could be cancerous or a cancerous lesion. And the nipple might be pulled in sometimes, and sometimes breast pain on and off, which does not subside with medication, and
right,
it keeps continuing for a long time. So that's
right,
another. It's basically something that you have to be very, very vigilant about. If you keep, the main thing is that you care of how your breast actually looks, if and
okay,
feel from like a younger age. So if you know, you'll easily make out if there is anything different. And you well
right.
go and meet a doctor.
Right. So I was wondering when you said there's going to be when there is breast pain, that is also a warning sign. It is very common for women that during your menstrual cycle, or just before, your breasts become very tender and they tend to hurt. So would that be have like do we have to take it seriously, or is just a regular normal part of your normal cycle?
So if you're clear about the fact that it's before your menstrual cycle, it again subsides, and then again it starts before your menstrual cycle, then that's something called cyclical mastalgia, which is cyclical breast pain, right?
Right.
Generally, is not, especially if it subsides, and they're all just hormonal changes that happen prior to your cycle, the beginning of your cycle, right? So
Right.
besides just you might have like heaviness of the breast. Sometimes you might feel lumpy, and
Mm-hmm.
so instead of if the same, it's always advisable to actually make note of the pain, like a chart, like a breast pain chart. So
Right.
you how often this pain actually, like you're actually experiencing this pain, what periods of time. So even when you come and meet the doctor, she know what exactly it is. So that's the first thing I
Okay.
would say. If you have breast pain, don't freak out. Just have a breast diary and write down everything,
Okay. Okay.
you know how to go about treating it. But if it does not subside, then that's something that you should be worried about. You should at least come and get checked at the end of the day.
Okay. So if I feel I have any of these warning signs, what kind of a doctor should I go see?
Okay, so honestly, in if it's just like specifically breast issues, I would
Right.
go to a specialist, right? Because for
I'm
all you know,
sorry. I'm sorry. Can you repeat
a,
that?
a breast
A breast
specialist
specialist? Okay. Okay.
studied a lot about breasts as such and knows
Okay.
I wouldn't say everything because no one really knows everything,
Right.
but how to treat most common causes, and like that is generally, breast is an issue which people generally take it, they don't take it too seriously, because they just like it's not that general surgeons and oncologists cannot treat. Of course they can. They're very,
Right.
very, they're obviously trained. But if there are certain issues such as benign issues, I would specifically go to a breast specialist because she would be well aware of every single aspect
Right.
of the breast.
Right.
But the other thing is that mindset. Sometimes when you take a patient who has just breast pain or like some benign issue, right,
Mm-hmm.
to oncologist, it really messes with their mindset as well.
Just going
Seeing,
to an oncologist.
why should I go? I don't have any time
I know.
there. So in that, on that side, well, that's what actually pushed me towards getting the breast and being a breast specialist. because I
Oh,
had
okay.
a relative whom I had to take for a breast issue without
Right,
cancer, and I ended up
right,
taking her to an oncologist, and
right,
she
right, right.
was really, really scared. So that's when I decided to do something specific to the breast. And I have a couple of colleagues also who are doing, a very good job in breast diseases.
Right. So also, are there a lot of different types of breast cancer, or is it all the same?
No. So biologically speaking, yes, there are a few different kinds of cancers.
Okay.
Completely depends on the kind of cancer, the biology of the tumor, and it also depends on, well, there's something called a sarcoma, there's something called a cancer. It's very, very medical.
Okay.
And
Okay.
it also depends, the prognosis of the patient also depends on the type of cancer it is. There are like different kinds of breast cancers.
31. Did you say 31?
12 to 13.
12 to
Around
13. Oh my God. That's still pretty high though.
It is, and that's where our pathology friends come into the picture. They are the ones who can give us the exact, diagnosis and what pathology. And based on that, we go ahead and plan surgical treatment, medical, the chemotherapy aspects of it, or hormone therapy.
Right. So when you say screening and we need early screening, right? How does early screening help? I mean, how does it matter if you're getting screened from 40 or when you're getting screened at 50?
What if you develop a cancer between 40 and
Dr. Pragna, we have Charan saying that your voice is breaking. Could you please check your connection once? Yes, I just saw that too.
Is my voice breaking?
Now it's fine. It's on and off though.
Oh, wait, hang on.
Yeah.
Uh, think, is this okay now?
Yeah, it's okay now.
Okay, yeah. Where were we?
We were talking about why early screening is necessary and why can't people just do it later?
So what? So that's exactly what we're saying, right? Nowadays, cancers have, the age group of cancers have changed, and now it's more in the younger women, right? And
Right.
from 40 onwards, there have been statistics and studies saying that, for example, in the 30s, it's 1 in 258 women being affected with cancer, but once
Right.
she 40s, it jumps to 1 in 67. So you can see the wide variability right there, which
Right.
is why
Right. Right.
in the West they say that again start screening from the age of 50, but the
Oh,
Indian guidelines which we follow, and well, in India I think 40 is recommended with the
okay.
clinical examination as well as a mammogram.
Oh, okay. I was actually reading somewhere that in India by 2030, the most common cause of death in women because of a disease would be breast cancer.
Yeah, it already is.
That is quite shocking.
It's quite
And that is quite shocking. And also the fact that people don't know about this.
well.
It's
Um, there are a lot of institutions, a lot of doctors are doing a lot of work in trying to get breast awareness. Even in our own city, there are a lot of people, and there's pinkathons, and there's so many of them going
right,
on.
right,
Um, of course, it's a little tougher to get through to the rural population, but that's not
right,
undoable. So people are doing their own bit of work, but a lot of, I guess, in our country, unfortunately, issues are still right? So that has to be overcome initially. And this awareness as such should increase a lot more than it is at this. Because when I was actually talking to a couple of people about examination and the pamphlets that I sent, you
right,
know,
right, right.
had educated people. They were like, okay, fine, I didn't know about this. So, that kind of surprised me, and at the same time gave me the thought that there's a lot for me to do, not
Right.
only in rural areas, but even in the urban group of people.
Priyanka says that's why you're trying to create awareness. And she's also saying you're still breaking.
I don't know what the issue is.
Do you want to like join back or something?
No, 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 no. The internet is connected. I think it's raining, right? So that's the
Yeah.
issue. It's raining like cats and dogs out there, which is why the internet is being unstable. I was just praying that there's no electricity loss suddenly.
Yeah, thank God. I mean, so coming back to the topic, so let's say somebody in the family has breast cancer. Should I be worried?
You shouldn't be worried, but you should be very vigilant, because anyone with a family history of breast or ovarian cancer, especially in the same lineage, for example, your maternal side, like blood related, it could be
Right,
your
right,
paternal side. If it's like maybe with ovarian cancer or breast cancer, you
right.
should make sure that you meet a genetic counselor, right? First of all, understand your family history. Make sure you know at what age they were diagnosed with what disease, how they passed away,
Okay.
and like, if they've passed away or not, because sometimes we don't remember our great grandparents, right? So I think
Right.
the family has to be charted out by a professional genetic counselor, and then they will tell you what kind of a risk you are and for what genes, and you can get a test done if it's a complete genetic
Right.
analysis based on the risk. Or they might just say, get these get this imaging done and get examined from this age onwards. And
So,
it's sorry, it's
no, no,
generally
go ahead, go ahead.
that for example, someone's mother had a cancer at the age of
Okay.
50, right?
Oh,
So
okay.
you start screen of not 50, let's say 40. Then you
Okay.
start yourself from 35. That's
Okay.
5 years in what age that the patient was detected cancer from at.
Okay. So, when we say somebody has cancer, what would the treatment be like?
There are lots of options. There's surgical options, and then there's obviously one thing you should know is that breast cancer is unfortunately a systemic disease, right?
Okay.
So you have to have systemic treatment in the form of either chemotherapy or hormone therapy. And
Okay.
surgery and radiotherapy is a local treatment, radiotherapy.
Right.
And such as targeted therapy based on the receptors that are in your, that's driving cancer, and
Right.
chemotherapy. So there are a of lot of modalities of treatment, but also important, which is, um, in my opinion, forms a complete circle of treatment, are physiotherapists, counselors, and
Okay.
nutritionists. I think they
Okay.
are extremely important for the quality of life of a woman,
Mm-hmm.
because a lot of complications that can happen with surgery they have dealt by the physiotherapists,
Right.
and
Right.
because anyone with a diagnosis of cancer will break down, right? So that's very, very important. So all these put together are like, it comprises of the treatment for breast cancer.
So, I mean, so let's say someone has breast cancer. Does that mean that they'll have to undergo a mastectomy or no?
No. So not every person with every woman or man with breast, okay, woman, let's not say man. Um, every woman does not have to have a mastectomy. Of course, we have to see the biology of the tumor, the size of the tumor, and we have to understand
Okay.
steps of where the tumor is in the breast. And based on that,
Right.
with the advances today, breast conservation is absolutely feasible, and not
Okay.
only but even reconstruction to make it almost seem like the opposite. That's
Right.
what I'm saying.
Right.
Quality of life is so important
Right.
that with today's advances, oncoplasty, that's what it's called, oncoplasty,
Uh-huh.
local reconstruction, or like, plastic surgery in breast.
Right.
So
Right.
it's coming up in India. There are a lot of doctors doing that, and
Okay.
people opt for it.
Right. So Prema Sudarshan has a question for you. How
Okay.
early is it important that it be diagnosed for higher chances?
Sorry?
I think she means like how early should you get it screened?
From the
Like,
age of 40 onwards, from the age
right,
of 40 onwards, if you don't have a family history of breast cancer,
right,
uh, start with clinical breast examination and an annual mammogram,
right.
right? Uh,
Because
yeah.
no, no, I think she was saying like how does it lower the risk?
It doesn't lower the risk, it just
Okay,
detects earlier stage compared to, example, you don't find, sometimes you just examine your breast and you're like, fine, it
right,
feels, I'm fine. But with, both a mammogram as well as a clinical breast examination by a healthcare professional, they understand what the changes can be. And,
right.
you can detect in an earlier stage. But
Okay,
in fact, I had a patient who just said that she examined herself, I think very, very small, so whatever, she'll be fine. And then she ended up coming to me with an 8 centimeter lump, which is massive,
oh
right?
wow, right,
So it's extremely important that examination in an early stage and reach out to the doctor if there is anything wrong.
Okay. So if anybody else has any questions for Dr. Pragna, you could just message us. Dr. Charan is saying that we guys are doing a good job. In fact, a great job.
Yay.
And Satya says wonderful topic.
Thanks to you, Spurthi.
Thanks to you for being here. So I actually want to talk about some myths. We have 5 more minutes. So I just want to talk about some myths associated with breast cancer. One such myth that I've come across, I've actually read about this in the paper as well a while ago, is if you use an antiperspirant or a deodorant, there's an increased risk of breast cancer.
No, so it's not that. It's basically the chemicals that might cause some issues if you keep if you keep using it. But it's not like
Right.
using an antiperspirant will get you breast cancer. No, it's none of them directly have a relationship. It just depends on the components of anything that you use on your body. That's why most creams, like these new creams that are coming up into the market, all of them also have to be logically signed off. Otherwise, what you're applying on your skin, and skin cancers are quite high because of right. So that's a myth.
Okay. And also there's a myth, a very common myth, that only women get it.
No, like I mentioned in the beginning of this conversation, 1% of all the cancers are in men, and exactly why the men should examine their breasts every month and make sure they reach out to any doctor if there is an issue, because in men, if and when they have cancer, it's going to be aggressive. And this, the prognosis is relatively poorer for men compared to women.
Right. There's another myth that breast cancer is contagious. I mean, as a doctor, I know I shouldn't ask you some questions, but I just want to clear it out for everybody.
Yes, absolutely. So breast cancer is not a communicable disease. It happens because there's some cells that go all haywire, and there's uncontrolled growth of them, and that is the reason why you get any cancer in your body, for that matter. And cancer as such is not communicable. So yeah, that has to be cleared out. It's not contagious.
Okay. And does IVF cause breast cancer in any way?
So it's okay. That's a very good question, actually. IVF as such does not, but what happens in IVF is that they stimulate the women initially. They inject a lot of these hormones in.
Right.
So as such, hormones such as FSH, LH, etc., they increase to a certain extent, which might increase the risk to a certain extent compared to not. But there's no direct correlation between IVF and breast cancer.
Okay. So is there any correlation between breastfeeding and breast cancer? Like, is breastfeeding going to help your risk decrease or anything?
So so there are a few factors, such as having children at an earlier age, and having increased number of children, which is not advisable in today's situation.
Right.
And then there's early commencement of your periods, late hours. These are the factors. What exactly happens is that there's the estrogen levels in your body, they go down during breastfeeding, and a couple of things like when you have children, etc. So when the overall estrogen exposure is low for even a short period of time, so that protects you against breast cancer to a certain extent.
Okay.
At that, I've seen patients who've had like 10 kids also, who've breastfed each and every kid. So in my opinion, it's a little confusing. So I wouldn't really go ahead and advise, to have 10 children, to have it only under 25. Yes, it's protective for the kid and the mother if they have, if they breastfeed the child and if they're at a age, but push for it because there are contradictory, aspects in the practical sense.
Right. We have a question from Nikki about how frequently should we go for screening. You said once a year if you're older than 40. So what if you're about 20? How often do you get screened?
You don't have to. Ideally, from the age of 25, you examine yourself and you can go for a physical breast examination. If there's any wishes, you go for an ultrasound in a woman younger than 40.
Okay.
don't get a mammogram at such a time, right? So,
You're breaking, Pragna. You're breaking.
oh, can you hear me?
Yeah,
Yeah.
yeah, I can.
So you don't get an ultrasound, you don't get a mammogram in a woman younger than the age of 40. You get
Okay,
an ultrasound for any abnormality. And
okay,
strong family history, the other modality of the investigation is an MRI, because that
okay,
makes things clearer compared to a mammogram at that age.
okay. Sujata is asking a question. Does using OCPs increase the risk of breast cancer?
That's another interesting question, because ideally speaking, OCPs, if there is an increased estrogen content, they should cause breast cancer. But there were a couple of studies, women's health studies, which showed that it's not exactly OCPs, but it's a duration of you take these oral contraceptive pills for. If it's
Right,
more than
right.
factor, that puts you at a higher risk. Short,
Lower than, sorry?
if you take it for like longer than 5 years, etc., yeah,
Longer
you
than
are
5 years.
at a higher risk. Use it
Okay,
for short periods of time, for a few
okay,
months, and especially those at a higher risk. You wouldn't
okay,
want risk of getting breast cancer. That is those with family history or previous
okay.
radiation. Should use other methods of contraception, com- uh, compared to an OCP.
I also read somewhere that using OCPs for a short period of time decreases your risk. Is that
Oh,
true? No,
no.
there's no such thing. Okay, that's probably
I,
another myth then.
at least I haven't heard about it for sure.
Okay.
Yeah.
I think that's all the questions I have for you. Dr. Pragna, your voice is breaking, so please talk slowly, but um, our time is up. Thank you so much for doing this. This is much needed. Um, I hope we can make a change with this. Everybody here, Dr. Pragna is a breast specialist and an oncoplastic surgeon. She has her own Instagram page called Dr. Pragna Chigrupati. If you have any questions, you should reach out to her. Don't you also work in Hyderabad?
In American Oncology Institute.
So I guess you could also get an appointment with her. And yes, everybody here, like Dr. Pragna said, please get screened. If you're over 40, get screened once a year. Do self-examinations once a month.
Yes, once a month.
Once a month. Okay, once a month. Oh, yes, I had one more question. I totally forgot. I don't want to miss this. So if you're a man, do you have to get screened?
Well, mammogram is, you don't have to get screened with a mammogram, but clinical breast examination is important in a man.
Okay, okay. So that is for the men out there.
And examination, obviously.
Self-examination. All right. So that is for the men out there, and I think Dr. Pragna is going to be posting videos about self-examination of your breast. So do check out her Insta page as well. All right. Thank you so much, Dr. Pragna, for doing such a wonderful job.
Thank you, Spurti. Take care. Stay safe. Bye,
Bye.
guys.
You too. Bye-bye. Bye.
Bye.